one of the things that I know is that there are armies of professionals and leaders like yourself that have dedicated their lives to helping organizations create a better, healthier, more productive environment. But specifically, there's others like you that have dedicated their careers to doing that in the context of healthcare, caring for caregivers. Given your journey, given all of the amazing things that you're seeing and the very well-deserved recognition that your teams are getting, what advice would you have for those individuals that are either in your position of leadership or maybe in other, maybe more entry level or earlier in their careers, but are very passionate about the type of work that you're doing? What advice would you have for them?
I would say it's a journey. It doesn't happen all at once. You have to start with a base and continue to build. I would also say that you have to have a leadership team that's supportive from the CEO on down. It's really essential that they believe in what you're trying to do and help support that initiative. But I think nothing, like I said, nothing happens overnight. It's a journey, and never give up, right? So persistence is key.
Yes, I agree. I think persistence and drive are really important in any industry. I also would encourage people to take every opportunity that comes their way and to throw their hat in the ring whenever something lights them up, because there's no straight path, I've learned, right, in your career or in leadership. I was a marketer. I never thought I'd be doing what I do now, but it was a great opportunity. We talk about imposter syndrome. The first year I was in the role, every day I felt like I wasn't enough. But over time, you build your skills, you learn, you're inquisitive, and you keep going. And so I would encourage anybody to take those opportunities, even when they're scary, especially when they're scary.
Especially when they're
Yeah,
scary.
especially when
If you
they're
don't have a
scary.
little bit of fear going into something new, then maybe you shouldn't be doing it. It's not pushing you enough to
Yeah.
grow, right?
And we have a great organization. People ask me, I'm going to be here 20 years next week, and people ask me why I've stayed. It's because they've never let me get bored. There's always something new. There's always a new challenge, good or sometimes challenging, right? In healthcare, it can be very challenging, but it's been amazing.
And you can't be afraid to fail. I mean, you should try. We just tried something with one of our benefits. It's not working out. We met yesterday with a group of clinicians, and we're going to pull back to the way we had doing it before. But we tried. And you got to be willing to admit when something's not working. All right, what's a solution? Not get defensive, but figure out what's the next. What can we do differently to make it improve for our team members?